Hey guys, everybody, we are here today with a very special guest. She is my sister. She is certified, what? Board certified in emergency. Hey guys, everybody, we have a very special guest with us today. We have a board certified emergency medicine physician, Dr. Jenny Bao. Hi, welcome to our show.
Hello, thank you for having me.
Yeah, so why don't you tell us a little bit about yourself?
Well, I obviously am board certified emergency physician. I've been in attending for about 3 years now. I graduated in 2017 from residency in Chicago. I went to medical school in St. Louis. I'm happy to be on to help people understand a little bit more about what's going on around us today.
Yeah, very uncertain times. So I'm glad we have you on, and thank you for being here. And so let's just get right into it. So we have a couple questions prepared.
Okay.
First one is from a Reddit user, and he wanted to know how you felt about doctors or physicians or anybody in the medical field being called a hero, or if you've ever been called a hero. So how do you feel about that? I
have not personally been called a hero. I think everyone feels a little bit different. Me personally, I think it's not just a job, it's a job that I'm happy to be doing. I signed up for this. I get paid for it, but in that aspect, I don't think of myself as a hero. I think sometimes people look at people in the medical profession, you have maybe a perception or an expectation of selflessness and almost a martyrdom. And while for some people they achieve more of that than others, I think when it comes to a pandemic, me, nurses, techs, everyone who is involved in the healthcare process, they are putting their health and the health of their family and their lives on the line to do their job. So in this unique pandemic situation, all of us has probably come closer than most have before to being a hero or a martyr. But my only concern with that phrase is I just don't want that phrase to be a substitute for helping healthcare personnel achieve their goals. So, it should not be a substitute for providing PPE, should not be a substitute for giving them supplies and the resources they need to do their job. And it shouldn't, be a term that, you use to give people so that they're happy with lower standards, I guess. If that makes sense.
Yeah, absolutely. Hopefully whenever people refer to medical workers as heroes, they're not using it in a, taking advantage of or,
right.
Just not taking for granted.
Right.
But in the light of, or in breadth of talking about equipment and PPE, another Reddit user asked, we've been in this pandemic for a couple months now. In the US here, we started taking it more seriously in March. We're now in July as of this filming. Mm-hmm. We know that in the beginning, we had a lot of issues with getting proper equipment and protective gear. But right now, after about 4 months, have we seen a change? Do you guys have proper equipment in the hospitals, or are we still lacking in some areas?
No, I think definitely in the last month or two, at least our own hospital, we've been well equipped. In the beginning when there was just a mad rush and a huge surge in demand for gloves, masks, gowns, things like that, across the nation and the entire world, everyone had a shortage. But I think as the months have progressed, production has ramped up, and better or different guidelines have come out as to how to reuse PPE safely. And now that we have more, we don't have to reuse them as frequently, which is nice.
Yeah, that's good. So because you guys have a lot of equipment then, would you say that it's a little bit less stressful in the hospitals as of right now?
In some ways. In regards to PPE, we have gotten a lot better in that we have more availability of it, but also things have reopened up. So for a while, elective procedures, all elective surgeries, all non-emergent procedures, surgeries, and hospitalizations were just canceled. And that was also in an attempt to conserve PPE, but now all that's reversed. So we've gone back to try to bring everyone back for the elective surgeries and procedures, and so now you're getting the usual volume kind of starting to trickle back in, and we are steadily seeing more cases of regular medical complaints, and with that also comes its own challenge in fitting that in with COVID and how to manage that and how to protect the patient, how to protect the staff from each other, essentially, and from other patients who might have COVID in the facility. So that's been the newer challenge.
Right. Yeah, definitely. And speaking of newer challenges with COVID in the hospital, how has the rise of COVID in the hospitals, how has that changed your guys' procedures in terms of what safety precautions you have to take for staff and other patients, like you mentioned, and also just how you treat regular patients that you may suspect have COVID or may just have similar symptoms, like what you would normally consider normal flu-like symptoms?
Well, so the screening process for all elective procedures is everyone has to have a COVID test of some sort within like 7 to 10 days before the procedure. So that's a new standard. A lot of patients who are getting admitted, for instance, there are certain wards that are designated as COVID, where everyone's donned up in PPE. There's negative pressure areas where you minimize the exposure of aerosolization of droplets. So depending on whether a person tests positive or is under investigation, so we say for COVID, we have to put them in certain units. For psychiatric patients, even if they are going to a psychiatric area, they need everyone to be screened for COVID to make sure that they don't infect other people in the unit, because they're not wearing masks. Discharging patients is also challenging because certain nursing homes, if you discharge a known COVID positive to the nursing home, you now just risk infecting everyone else. But at the same time, can't really keep everyone who tests COVID positive in the hospital until they test negative. That's just not a really feasible way to treat patients, and you would run out of room very quickly. So everything has just been so many moving parts, and I think we're all just learning. But with reopening came its own challenges.
Yeah, definitely. And so now that we are starting to reopen a little bit, we have a lot of states that are starting to roll back a little bit on the regulations and stay-at-home precautions. Some states are starting to kick that back into gear now that a lot of states are hitting record highs in terms of cases. But would you say that even though there may be a second wave that's coming, do you notice a difference in terms of mortality rates or just in general the demographic who does seem to be coming in that are infected, like if they tend to be younger or healthier overall?
Anecdotally, and I only work at one facility, small community center, so I can't really speak to larger urban areas. Obviously we're in the Midwest, but anecdotally, when it first hit us in early to mid-March, I would say the acuity in how sick the patients was much more dramatic, and that lasted for a few weeks for us. And the caseload of inpatient hospitalized COVID patients was much higher. And I think now, actually, even though we are still seeing some COVID and COVID positive as the availability of testing has gone up, the incidence has gone up, but the amount of people who are requiring oxygen or ventilators, me personally, I've seen them gone much lower. Also, that could also be an effect of us tailoring our treatment protocols so that we're not even as aggressive with putting patients on ventilators. So again, different contributing factors to that, but I would say they are generally a little bit less sick, at least in my experience so far.
Right. And definitely, speaking of treatment protocols, how has recommendations or the protocol for treating COVID positive or suspected COVID positive patients, how has that evolved along with the pandemic in the last couple of months? Because we know there's a lot of news out there, there's a lot of information and misinformation. It's hard to get it all straight. So how has that evolved for you guys in terms of what you have to do in the hospital and like the guidelines that you follow?
Well, it definitely has taken a multidisciplinary approach. As emergency medicine physicians, we're on the front line. But to admit a patient, our role is kind of in the middle. It starts with pre-hospital EMS personnel, and then it ultimately ends with inpatient hospitalization, infectious disease, infectious prevention, and then also discharges. So nursing homes have different protocol. I would say everything was just in flux for a while. No one really knew what to do because this was something that no one had really ever encountered within our lifetimes for most people who are currently practicing. Everyone tries to compare this to the 1918 flu pandemic, and no one who was really practicing then is alive practicing now. We were all trying to gather data, and I would only keep up with emergency medicine news, I would say. So we have continuing medical education, or CME as we call it, that we're required to keep up to date with. And so I subscribe to certain podcasts that are just basically keeping me up to date on the newest information. And so every chance I could get, I would try to just absorb everything that was coming out. What have people tried in other countries, in Italy, in New York, where people were seeing much sicker and much higher volumes of COVID, and how can I take what they've learned and apply it in my own practice? And so that was very helpful. The advent of technology, free and open access to medical education, CME, that really helped, I think, everyone across the world just communicate with each other and just giving each other and sharing what we had, even though none of it was really peer reviewed, because the whole process of scientific journalism really and academic medicine is you have to undergo rigorous testing or screening, publications, review before everything can get published, and then everyone can critically analyze your data and see, is this clinically significant? Is this an actual practice that I would incorporate? But with the virus not having known to be in existence before November 2019, and with everyone still getting sick, we pretty much had to rush everything. So papers were coming out that weren't being peer reviewed, and it was just almost too much information, and you almost just didn't know what to trust. And I think everyone tried to do their best to sort out what treatment would cause the least harm and have the most benefit, and then also trying to standardize it, because honestly, at one point, everyone was just kind of not doing their own thing, but kind of tailoring it to what we as clinicians thought was best individually. And to me, that felt a little bit uncomfortable. It's not really what I'm used to. I'm used to having, okay, I know how to treat heart attack. Okay, I know how to treat sepsis. Okay, I know how to treat stroke, because there's protocols and things that have been tested and for years and years. And we have a lot of evidence to back up what we do. And for the first time, I was without any evidence. And I was just like, well, I heard about this. Let me try it. Doesn't hurt. Well, I heard about this. Let me try it. Doesn't hurt. Does it hurt? I don't know. But I guess we don't have any other options. And so me personally, I felt like I was floundering a little bit in that aspect.
Yeah, definitely. I mean, it's very unsure whenever everybody's trying to learn on the go at the same time.
Exactly, yeah.
A lot of the protocols has changed for hospitals. What has changed in terms of recommendations for everyday people just at home, or anybody who's concerned about getting coronavirus, or maybe concerned they already have it? Because there are some people who, they know they're sick, but they don't know if they have the coronavirus. For some reason, maybe they can't get testing, or, they don't want to go to the hospitals because they don't want to overload anybody. So how should people, I guess, self-remedy if they think that they may have the coronavirus?
I wouldn't really, if you don't have symptoms, the safest way to protect yourself from getting it is obviously follow the CDC guidelines, wear a mask everywhere you go, if you go outside your house, and socially distance, don't participate in any large gathering groups of, we used to say 5, in some places it's 10, just depending on where you live. And if you have symptoms, I would really never suggest self-remedying. I would always ask. So there's lots of available resources that are constantly expanding now that testing is more readily available at multiple sites, and with your public health department, local ERs, urgent cares have them. You can always call one of those locations, and a lot of them will have also medical providers who can take a look to see if it is COVID. And so a lot of the symptoms we see with COVID are so varied, and once this information gets out to the public, it gives more information, but sometimes if there's too much information, you don't know how to interpret it, and also just can be misinformation. So a lot of symptoms can be misinterpreted as COVID, and I would not want somebody who is experiencing shortness of breath to just say, hey, I think I have COVID, because it could be a myriad of other things. Lots and lots of things cause shortness of breath. COVID is just one of them, and it's just one more differential diagnosis that we have to consider as a provider, but I would still leave that decision up to a medical provider. So your options are, you can always go to urgent care, emergency physician. You can always start with a primary care provider first if you have one. There's local health department hotlines you can call. I think there might even be COVID-specific hotlines, state by state, region by region. And then also there's more virtual options for virtual visits, because once a lot of urgent cares and clinics really shut down, patients still wanted to seek advice about things that were COVID and non-COVID related in regards to their healthcare. So virtual visits have become a big thing, telemedicine, so you can Skype or video chat conference with a physician or a healthcare provider, and then get advice, and then they can even direct you there. So lots of different options.
Gotcha. And so let's say that you consult your doctor and everything, and it's up in the air if you have COVID or not, but regardless, you're not feeling well. At what point should we just go to the emergency room regardless of our status of whether or not we know we have COVID? Because there are some people who get really sick and they don't know at one point, hey, is it serious enough to go to the hospital, or should I just stick this out? One Reddit user asked if oxygen saturation machines at home were necessary in order to monitor how serious your condition is. Do we need any sort of extra equipment or any sort of just like extra advice in terms of just guiding us in terms of when we need to go to the hospital?
So I think the difference in seeking the advice of a healthcare provider is you're getting someone's opinion on how to interpret the data that you have gathered. So having an oxygen device, knowing the symptoms of COVID, it doesn't necessarily mean you still can get a diagnosis. And so that's why I think it's really important to stress that you want to have an evaluation, even if it's just a screening one, by a certified healthcare provider. So I really wouldn't recommend someone trying to self-diagnose, or because here's the thing with the oximeter machines is if you get a professional grade one, even those can malfunction. If you don't get a good waveform, if you just read the number, it can give you a false reading. And then the ones that are available on handheld devices can also be pretty unreliable. And even before COVID, we would have patients coming in saying, oh, I think my heart rate's too fast, or I think my oxygen's too low. And they come in and we just check it and adjust the reading properly and it comes back normal. So if you ever have symptoms, I would still seek medical attention. If you think that the emergency room is the best place, go ahead and go. We do have a triage system, and now we have ways to kind of separate and diagnose potential COVID and maybe put you in a separate area versus non-COVID. So while there is always a risk of getting COVID wherever you go, emergency room, grocery store, your friend's house, I don't think that should deter you from seeking medical attention. And so you can always go and get triaged and get seen by someone, and then they can tell you, or call a nursing hotline. There's lots of nursing hotlines. You can call the back of your insurance card. They have somebody to give you more advice, but I wouldn't make that decision on your own.
Gotcha. So just for anybody out there who may have concerns, just reach out to a professional first and just roll with the punches and see what they suggest. Reach
out to somebody. They'll direct you where to go. And if it's the emergency room, it's the emergency room, right? Emergencies still happen every day. So.
Gotcha. Cool. Sounds good. So in terms of just general guidelines, I guess still recommend wearing masks everywhere you go, and I guess
distance for 6 feet. I think in gyms that are opening up, they say 12 feet, just because when you're exercising, you're aerosolizing even further with the breathing in and out. But that's, the best, easiest thing that we can do for ourselves and for others.
Right. So with the hospitals, I guess, are you experiencing still, oversaturation of like hospital beds or anything, or is it starting to tick down in terms of how full you guys are?
So for us, when COVID hit, we actually had the opposite. I think on the coast, like in New York and California, they were more saturated. They had more people, denser populations, and probably at baseline operated at near capacity, even pre-COVID. And I think that's why the guidelines were for the social distancing, because with our existing healthcare system already kind of on the brink of being overwhelmed, any minor stressor, let alone a pandemic of this magnitude, would have overwhelmed our resources. And so I think that's why distancing was such an important thing early on. For us, when COVID first hit, the patients were sicker, but everyone heeded those warnings and they really stopped coming to the emergency room. So our volumes went way down, especially because they canceled a lot of elective procedures, surgeries. So we saw actually a lot less patients. And as the restrictions have started to loosen and kind of been lifted, now we're seeing an influx of the usual medical complaints, non-COVID related and COVID related, coming back. And I don't think we personally have not been overwhelmed. So again, but we are in a Midwestern area and we're a small community hospital, so I can't really speak for every other hospital.
Right. Well, that's good that you guys never really got overwhelmed, because unfortunately a lot of places did.
Yeah.
So how has COVID then, if you guys haven't been terribly overrun in terms of like number of patients coming in, how has the rise of COVID and just the uncertainty of it all, how has that affected like your mental health in terms of just being a doctor? Because at the end of the day, even medical heroes are people, and we all have our struggles. And so, did you have any issues with like anxiety around the whole situation?
Sure. I mean, I can't tell you how many emails and updates from things that I never knew I subscribed to, who was like, in these trying times, and it sounds cliche, but yes, it's true. Everyone's anxiety, stress was at an all-time high, and then at the same time, all of our previous usual methods of relieving those stressors were no longer available to us, right? How do you de-stress? You get together with friends and family, you have a drink, you eat some food, and none of those were options anymore. So on me personally as a human, outside of being a physician, just having that bonding time with family, like we can see each other, we have video chatting, but it's not quite the same. You don't have those same spontaneous experiences. And then also everyone's sitting at home, like, what do you really talk about? It's like, hey, how are you? Still alive? Great, And so that was hard to kind of stay sane, but important, because then I had to remind myself that I'm trying to keep other people safe, especially with me personally being in my job. I'm exposed to it constantly, so I almost viewed myself as a contagion. And so for the sake of those around me, I really didn't want anyone to be around me, more for their safety than mine, to be quite honest. But that also made it really hard for me. It's hard to not have people there to relate to. Most of the people in my life are not in healthcare aside from my coworkers. So when you have a bad case, when you have a stressful day at work, you can't really talk about it with people who are non-medical. You shouldn't. And then the people who are medical, you can talk to each other at work, but outside of that, you're not really able to get together. You're not really able to de-stress, go out to eat, just kind of chat it out. So it's been tough, trying to resort to the usual stressor, like de-stressing factors that I have. Exercise was very important to me. I could no longer go to the gym. So luckily for us, it was springtime, so I could still work out and I had some equipment, but a lot of people are not so lucky. And for people who have families who then had to separate themselves from their families, not being able to hug your child, your spouse, that is really hard. I know some people went to really extreme measures and just lived in separate areas from their family just to prevent them from getting sick. So I can't even imagine the stress that they were going through, physically not being able to hug their immediate spouse and their children or their parents. So that was a unique factor with COVID of our job that no one really anticipated.
So a lot of people have asked whether or not there's anything that you've experienced in the hospital that I guess you were most surprised about whenever COVID first started rising, or anything that you think would surprise most people about the COVID cases that they wouldn't normally think about.
Yeah, there were a lot of distinctive features about patients who had COVID symptoms. So, people have commented on the loss of sense of smell and taste. Usually that can happen with a common cold if you get really congested, but it was in the absence of nasal congestion that people were even experiencing that. So then that became kind of a distinctive feature of a screening question that we ask: have you had, cough, fever, shortness of breath, and or loss of sense of smell and taste? And some people really just had the very mild form of that illness and didn't have the other respiratory stuff. So that was interesting. In the beginning, when I first saw the really sick wave of COVID patients, there were a lot of patients who, us in the medical community, we called them happy hypoxemic patients, which were patients with profound hypoxia, which means extremely low oxygen saturation that you'd normally see that's barely compatible with life. So a normal oxygen saturation for a person would be anywhere between, say, 97% on room air to 100% on room air. You can maybe go 95% unless you have pre-existing asthma, COPD, lung conditions. But in patients who had COVID, they were coming in awake and talking, didn't even feel short of breath, is the funny thing. Felt fine, but that when you measure their oxygen saturation, it would be as low as 70s. In some places, some people even saw 50%, 40%, and those are numbers that are not really quite compatible with life. So as medical personnel, we see that and we panic, but then you look at the patient and they don't even seem to be bothered by it. So that was really a disconnect, and we're still trying to understand the pathophysiology of why that happens, because usually if your oxygen is that low, you become confused, you're essentially depriving your tissues and your brain of oxygen. It doesn't really make sense why you would still continue to function so normally, and then it also makes me wonder how long they had been like that before they even felt anything remotely bothersome enough to come to seek medical attention. Had they been hypoxic for days and just not felt it? So that was definitely something unique and a little bit scary about COVID patients that I saw. And then also was a difficult thing to treat, because typically when somebody has such low oxygen saturation, they feel like they're struggling to breathe. They feel like they're drowning. So then you have to be very aggressive. You have to give them breathing treatments, put them on, we call BiPAPs, non-invasive mask ventilation, or you have to put a breathing tube in, like a ventilator, intubation. But when you do that with somebody who has a low number but looks okay, it just feels strange to have to talk to somebody about putting them under a coma to put them under ventilator when they're telling you, and not confused at all, I feel fine, why? So that was something that was definitely unique to COVID.
So is there anything that you might have experienced or heard about that you think would shock most people about COVID? Like something that maybe isn't getting talked about enough in the news?
I mean, thankfully I haven't experienced this personally. There were some case reports of healthcare personnel who would be seen out in their scrubs and have people either panic around them, some as extreme as pouring bleach on them. So, in the middle of a pandemic, I know everyone is afraid, and fear can make people very irrational, but that certainly does not help as a healthcare personnel. And I don't wear my scrubs out and about, but sometimes I do stop at the gas station on my way to and from home, especially because since there's nowhere else to go in a pandemic, the only time I'm going to get gas is before or after my shift, and usually I'm in my scrubs. And so that also added another level of anxiety, and as on top of everything that was going on, now we had to worry about our safety. If the public knew that we were in this field, how would people around us react? Would they shun us? Would they attack us? Conversely, the amount of kindness and support that we got from the community was also very heartwarming. We had a lot of free food donated to us from local restaurants who were already struggling, just showing us their support, and that was really great. And a lot of people, when we had a PPE shortage, they made 3D printed face shields and just donated them to the ER. So that was really great. We had people calling in and asking, how can I donate? Do you guys accept, do you need masks? I can get you this, that, and the other thing. And that was all just the best side of humanity that we don't always get to see. So.
Okay, so another question is, somebody cited other countries such as Sweden or Switzerland, maybe, where they're kind of relying on herd immunity for vaccines, or not necessarily vaccines, but just people staying healthy from COVID in terms of trying to keep the overall country healthy. And so, obviously we're all waiting for a vaccine to come out for us to feel safe and going out and everything. Do you think that that is something that we should worry about in terms of herd immunity here in the US? Because unfortunately, there is a minority population to where they believe that, they shouldn't get vaccinations or anything. So do you think that even if a vaccine comes out, it'd be effective?
There's a lot of factors to consider with that. So the virus is so new that even if a person contracts it, we don't know how long, or if at all, they're immune. Granted, I'm not an epidemiologist, I'm not an immunologist, I'm not a virologist, I'm not a microbiologist. So my knowledge of the virus is very limited, and in day-to-day practice, definitely not very in-depth. But previously, coronavirus as a family has been mostly contributed to kind of common cold symptoms. Most people have experienced and contracted various strains of coronavirus, not necessarily SARS or SARS-CoV-2, which is what we're dealing with, but we don't know that these patients are immune. We don't know yet. It hasn't been around long enough for people to keep getting reinfected. People have been testing positive even after their symptoms have resolved, but still not really sure whether it's viral shedding, if it's a reinfection. The swabs and tests themselves were not very sensitive. I believe the number that I was reading initially, and this is the PCR test, was only about 70% sensitive. I had read a study of really, again, not peer reviewed yet, just 18 or so patients in China who were admitted for COVID, and they swabbed them every single day for about 10 days or so. And there were days in between where the swabs would come back negative, and then the day after it would come back positive. So we're still not sure why in certain days somebody could test negative, but really still have the virus. So even kind of teasing that part out is, I think, a little bit of a challenge. And then also, whether if you do have immunity, how long it lasts. So it's probably not something that's going to last forever necessarily. So depending on what type of vaccine you come up with, if they can guarantee lifelong immunity, that'd be great, but I don't know how feasible that is. And then of course, with anti-vaxxers, that's always going to be prevalent, and people will hold certain beliefs that they don't believe in vaccines or Western medicine or whatever. So I don't think it'll ever really reach 100% vaccination rate, unfortunately. So as far as herd immunity goes, I think we can probably do, if we have an effective vaccine, an effective means of testing, I think we can get a pretty good number, but I don't think we're going to get everyone. So that's everything.
Yeah,
even,
for sure.
Yeah, even current vaccines that we have, not everyone's on board with it. So that's just the reality.
Yeah, I guess that's a good point. There's tons of vaccines and haven't had too much of an issue with those other ones so far. So something you mentioned though was that you were talking about how this particular strand of coronavirus is different from the other ones we've encountered. So just for anybody who may not be familiar with different, I guess, classifications of like diseases, what is like the family of coronavirus, and how does what we know of COVID-19, how does that fit in with the general family of coronaviruses?
So again, not a virologist, not an epidemiologist, not a microbiologist. My understanding of SARS-CoV-2 is that, so the ones that people have been, in our community, medical community, have been comparing it to would be the first SARS. SARS-1 in 2004, I believe, and then comparing it to MERS, which was also, I believe, coronavirus, and then comparing the mortality rate, morbidity rate to influenza. That's really the most popular comparison. From what I was reading, the first SARS was actually more lethal in terms of its mortality. Symptoms started sooner, manifested sooner, but in that sense, it didn't spread as quickly because you could trace people easily. It was easier to kind of quarantine people because they developed symptoms more rapidly. And with SARS-CoV-2, there's this question of, are there asymptomatic carriers who are out there spreading it and never having symptoms? And also a long incubation period where you have been infected, you're shedding, but you don't have symptoms and you don't know, and you're still spreading it. And that makes SARS-CoV-2 more contagious in that aspect. But as the incidence, meaning the number of cases of SARS-CoV-2 that we know of goes up, the number of people that we can attribute as having died from that disease relatively will go down, meaning the mortality will go down, right, as the number of people we know having the disease goes up. So it's just a fraction. So trying to pin down a numerator and pin down a denominator initially without the lack of available testing has made it very challenging for everyone to really get accurate numbers. How lethal is it? What are the numbers? We just don't know. Now we're getting more, and probably for months and years to come, we'll come to learn a lot more about this virus and this disease. But right now, we're still, unfortunately, in the data gathering phase.
And speaking of data gathering, do we know anything about how the tests are, if they're like becoming better in terms of being more accurate, or if they're being more widespread? I know you mentioned, consult professional help if you ever are concerned about your health or anything, but in terms of just for everybody to know in the back of their minds, like, do we have more tests widespread right now as opposed to a couple months before, and are they more accurate than before? Because we know, like you mentioned, there are a lot of false negatives or positives.
Mm-hmm. So definitely there are more. The one that we're used to and our, I guess, gold standard is the PCR. So it's a nasal swab, and you have to go both nares into both sides in order to get a good enough sample. And then you run that. And the PCR is a polymerase chain reaction, so it just takes a little bit longer. For us, the turnaround time is it's like couple hours, but only one hospital in our system does it. So if you swab it at my hospital, for instance, you have to wait. They make 2 trips a day. So then they, get a bunch of the samples, they run it to a different hospital, then they run all the samples, and then they result everything. So that's one delay. There have been a lot of antibody tests. Now I'm hearing about point of care testing, which I'm guessing is like maybe a finger stick. Usually point of care means something that's rapid, maybe a swab that turns around in 15 minutes. So you have a result that you don't have to wait for. Generally, point of care tests are less reliable. They're just less sensitive and they're less sensitive, yeah. So I don't really know about how rigorous the testing has been for those tests. So I think a lot of people are amping up production saying we have this test, we have this antibody test. But as a consumer, I would probably advise really look into what those tests are for and how accurate they are. Because the thing is, it's such a new virus that you can easily be misled. What's the danger? So you could have a false negative and have the virus. You also, if you're paying for it, you don't want to pay for something that's just not going to work. So some tests may test for all coronaviruses when what you're really wanting to know is, do I have SARS-CoV-2? So I guess just be aware as a consumer that not all tests are created equal. And just because you swab negative or tested negative here may not necessarily mean that you don't have it.
So if you test once and for some reason it says you're negative, but you're fairly confident that you have it, or for some reason you believe that you have it, are you able to get tested again, or it's just like a one-time thing and you're done?
In the beginning, we had less available testing, so we couldn't even test people who had symptoms unless they were severe enough to be hospitalized. Now we can test sort of all comers. So I would say we are testing people multiple times. So if you think you still have the virus or symptoms, or you tested negative a week ago, but now you feel different, you can get tested again. And different facilities have lots of different options. So the antibody test, the point of care test, and the swab. The one that we are used to and that we use in the hospital is the PCR nasal swab. And that's the one that's most painful to most people because they go way back there. It makes them cry. It's very painful and the patients hate it. But that's the best that at least we have right now. And even that test was not 100% sensitive. Nothing is, but.
Right, yeah. One of the last questions here is, with everything being so uncertain and we've been under quarantine for almost half a year now, we still have very little to no indication in terms of when we'll get a vaccine out. And we're starting to get into a little bit of a second wave here in the US. When do you think that people can expect for things to start to get better in terms of returning to some sort of state of normalcy?
I don't want to give false hope. And at this point, I think most people can agree that it's really never going to be the same as pre-COVID in almost every aspect of society and life, both medical and non. And the reason is because, so say they develop a vaccine, and to reach human trials and post-marketing stage 3 and 4 of clinical application for a drug, it takes a long time. You have to make sure it's safe, you have to make sure it's effective, and you have to test on animals, test on humans, a lot of research behind the scenes before it even gets to testing on anything live. So I think we're still far out from that personally. And you don't want anyone to rush a vaccine that's gonna be not safe, right, or ineffective, that does no one any good. But kind of like we touched on before, even if there's a vaccine, you're not really going to get 100% compliance with everyone. So it's not going to guarantee you herd immunity. Pre-COVID, our way of life of having large mass gatherings, concerts, parties, school, universities, colleges, military, all of that's really going to change, and it has already. Just by nature, certain aspects of society are going to be harder to self-quarantine or isolate and maintain safe distancing. So we're seeing that with dine-in in restaurants. A lot of restaurants have limited capacity. You have to separate out every other table. A lot are doing just curbside takeout to go. And even the ones that are doing dine-in, you have to thoroughly clean everything before and after. Gyms are only allowed to operate at 25% capacity, and again, kind of separating out every other treadmill. You have to wipe down your equipment. They're only open for limited hours in order to clean all the equipment thoroughly in between. Personal training sessions, they're making them longer so that in between each client they can clean everything. So all of that, I think, is going to stay with us for a long time. And I don't know that that's really ever going to get better. Concerts are still canceled. I don't know how long it's going to take, if ever, for people to feel safe enough or have it be okay enough to gather in thousands and stadiums for sports events and things like that. So as far as those things are concerned, I would say at least not for another year or two at least. It's possible that it could be never. I mean, that would be sad, but yeah, I don't know.
Yeah. And so everything is just up in the air, so this is hard to say.
Right.
And I'm sure even though you're a doctor, you're kind of just getting the same information as a lot of people are. In the moment.
Yeah. It's hard to stay active, work, and then also try to keep up with the medical knowledge. I mean, it was just very saturating, and so sometimes I check out as well. You know, I need to watch some Netflix just like everyone else and kind of just turn my brain off just to keep my sanity. So. Yeah.
Well, I hope that you do okay in terms of keeping yourself good and
Thanks,
a good
brother.
mental health state. That's all we have for questions. Is there anything else that you want to tell people in terms of if they don't get anything else from this interview, if there's something that you want them to know or take away from this interview?
Sure. I think this is a good, if nothing else, good, if you can even say that, comes out of COVID. This just kind of highlights a lot of the existing problems that we had before in healthcare, in society. So I hope that we all take this as a lesson and make the best going forward out of all this, meaning make the changes that we kind of put in the back burner going forward, because the way that we were doing things before clearly weren't working, because this stressor has shown us all of the cracks in our society that we could fix. So I hope that we do the best we can to fix it, because the next time, if there is a next time that we have another pandemic or another big catastrophe, we should be prepared. You know, we'll treat this as a fire drill, even though there is actually a fire, but yes, let's use this as a fire drill per se. And good luck to everyone out there. Stay safe, stay healthy, mentally and physically. So.
Sounds good. Okay, that wraps it up. Thank you for coming.
Thank you for
Very
having
much
me.
appreciate your time and your knowledge.
Thank you.
And maybe we'll talk again in the future.
As possible.
maybe. Okay, take care, everybody. What's up, everybody? Thank you all for watching. I hope you enjoyed it. I know this was a little bit different from last time, where instead of a live segment podcast, this was a little bit more of a formal interview. But regardless, I hope that you found it entertaining and informative. We're just trying to experiment with different things. Speaking of which, we have another big project coming up. That's another more formal type interview like this. And I'm really excited for it. I think you guys will like it a lot. So if you liked what you saw today and want to see more, please subscribe and hit the notifications bell so that you can be up to date for our new content. Otherwise, if you have any ideas of what you would like to see next time, or what you want to hear about, or even just what we can improve for next time, please don't hesitate to let us know in the comments below, and we'll try to get to everything. Otherwise, I hope to see you all next time, and have a good one.